guys, welcome back to the channel, and this is your last unit of OBG, that is chapter 12, Family Welfare Program. From this chapter you will get one question for 5 marks and two questions for 2 marks. 5 plus 2 plus 2, that is 9 marks. If you study this chapter you will be perfect with 9 marks. Come, let's start the chapter. Family Welfare Program. This program came into action so that they can provide a good health care to prevent the disease and to provide knowledge regarding the disease, signs and symptoms, and what are the treatment available for that, and to reduce the death rate and the disease rate. It focuses on the family members, but mainly on the vital family members. Those are the mother and the child. In mother, if you see, we have active plans like MMR, Safe Motherhood, ANC, and SIP, and many more, but these are the active plans. ANC is antenatal care. Antenatal care is nothing but the care provided to a pregnant woman at the time of pregnant till the delivery section. The care is provided is known as antenatal care. In this care we have regular checkups. In routine checkups we will get to know how the baby is growing, is there any defect or not, how the mother's condition it is, like if mother has any disease or not, like underlying conditions, hypertension, BPs, like that. Those are ANC. In SIP, if you see, that is Sector Investment Program. In this program, the government provides money so that they can provide a good health care to the mothers in the rural areas. This two, ANC and SIP, are the minor programs. In this, the main program are MMR and Safe Motherhood. And next, in the child, if you see, RCH and ICDS. And the last one, population control programs, that is nothing but the family planning programs. The first topic is MMR, maternal mortality rate. This is nothing but the death rate of the mother during the delivery section. It is calculated by the number of living mother, those are in reproductive age, upon number of mother who are dead during the childbirth. If we calculate number of dead mother divided by number of living mother, we will get MMR. Causes of MMR: hemorrhage, sepsis, that is the infection in the blood, and underlying disease condition like hypertension and diabetes mellitus, thyroidism, miscarriages mostly above 3 months, prolonged labor, and then direct causes like consuming overdose drugs, like that, and indirect causes, the environment causes and the external causes. These are the causes by which the MMR is caused. And next we have preventive measures. How to prevent these conditions? First is finding the pregnancy earlier. If we detect the pregnancy earlier, so that we can provide the care to the baby in an early stage itself. After detecting, in the total pregnancy time, at least we need to visit the doctor for routine checkup at least for 3 times minimum. And then we should follow a good diet supplementaries recommended by the doctor, mainly to maintain the blood level, because the mother is providing blood to the baby, so mother may have a deficiency of blood, anemic condition can occur. And then in the routine checkup we will get to know, is there any risk condition present in the mother or any harmful condition that is present in the child. And next, treatment will be provided if there is any underlying disease conditions like hypertension, diabetes mellitus is detected. And then to prevent infection and hemorrhage is also medications will be provided. These are preventive measures. Next topic, Safe Motherhood. Here you, by the name itself, you will get to know that we will provide care to a mother, that is providing a care to a pregnant woman so that she can give a healthy birth. It is almost like the ANC. What the function performs by ANC, that is the function of this, like regular routine checkups, preventing the high risk pregnancies, providing a good dietaries, and keeping the mother healthy and the baby also healthy. That is the main aim. If we keep the mother and baby healthy, automatically the death rate and the disease rate of the mother and baby will be reduced. So there are 6 pillars to keep the mother safe. Like first is family planning. Family planning is not just like stopping the baby. In the family planning we can get more informations about how a healthy pregnancy can be followed, like planning the timing and spacing. Mainly spacing in the sense how many years or how many months there should be a gap between one child to another. Normally 2 years gap between one child to other child is a healthy spacing. And next, antenatal care. Antenatal care, that is during the pregnancy time, regular screening, good healthy diet, walking, keeping away from the unhealthy environment. These are antenatal care. Next, obstetrical care, that is informing about the delivery process, how the pain occurs, and mostly what are the signs and symptoms, minor problems seen during the obstetrical conditions. And next, postnatal care. Postnatal care is after delivery. After delivery also there will be lot of problem like infections and mainly lactation. How to feed the baby, to not follow bottle feeding, the breastfeeding should be given, how many years it should be given, and what are the foods can be given to the baby, techniques of lactation, and then how a mother can stay healthy, how a mother can prevent the infections and depression, her mental condition, because of hormone falling down suddenly she'll be affected mentally also. For that also in postnatal care we will provide care. And then post abortional care, this is mainly for the emotional support. Because of abortion the mother will be disturbed psychologically more. Here we'll provide care for that. And then at last we have in routine examination we will try to prevent the sexually transmitted disease from the mother to the child. These are the pillars to keep the mother and the baby safe. In maternal health we have been completed MMR and safe motherhood. While now in child section we have RCH and ICDS. RCH full form reproductive child health. This program mainly concentrate on providing health care, providing knowledge, and preventing the death rate and disease rate, and preventing the illness in the mother, infant, and the child. It was launched in October. As I said, it belongs to child section. Why we are concentrating on the mother? It's because generally mother is provided care during the time of pregnancy. If you provide care to the mother, then automatically the baby will be healthy. So that's why mother is included in this program. Components of RCH: preventing the unwanted pregnancies, like if the baby which is present in the womb has some kind of defect, or it is having a congenital malformation and we have been found it very early stage, then the doctor will advise to undergo the abortion. So like that unwanted pregnancy will be eliminated. And the mother care during the pregnancy condition, during the delivery, and after the delivery. In 3 stages also the care should be provided effectively. And child survey, this survey is useful in the case of providing vaccines on time, or to find what is the disease rate and death rate and illness rate in the child. And management of reproductive tract infection and sexually transmitted infections, and providing knowledge about it and management will be provided here. And a referral system, it is a unit which provide knowledge and people can contact them and ask whatever the doubt they have. They provide a referral unit for that. And reproductive service for adults on age also. And then sexuality, gender information, education, counseling, treatment will be provided here in the RCH. And next we have ICDS scheme, that is Integrated Child Development Scheme. And this scheme has been came into our community very earlier in the October month itself. And this scheme mainly concentrates on the malnutrition kids, how to reduce the death rate and disease rate of the child, and how to promote the children to go to school, how to promote the education level in the children's. That is what this scheme is focusing on. Family planning program, this is a program which is introduced into our community so that we can practice the control of number of children in a family and to provide the interval between the childbirth. From first child to second child, the interval should be, the gap should be at least 2 years. This method is practiced with the help of contraception and voluntary sterilization. According to WHO, we do have a definition, that is the ability of individual and couple to anticipate and attain their desired number of children and the spacing and timing of their birth. The definition might be different, but the meaning is same. That is to control the number of children in a family, and we need to provide time for each birth. Next, we have a family planning method. In family planning method, we have two branches, temporary method and permanent method. In temporary method, for a particular time, the couple can have a sexual intercourse, but still they can't attain the pregnancy condition. That is temporary method. And in permanent method, when the permanent method of family planning is performed, after that, even if the couple is involved in the sexual activities, the chance of getting pregnant is very less. Like in 100, only 1% or 2% of chance of getting pregnant is seen. Only when the technique is failed, at that time the woman gets pregnant. This is temporary and permanent. In temporary, we have 5 types: natural, biological, chemical, mechanical, hormonal. While in permanent, we have 2 types: one is for female sterilization, other is for male sterilization. There are few important terms in the family planning program. Let's know it. Like family limitation. Here we are controlling the number of child. It's not involved like spacing, interval and all. Here we are controlling the number of child with the help of birth control method. And this method will be only practiced when it is safe to be used and there is no side effects seen in these conditions. Like condoms will be used, and IUDs, rings. This doesn't have any kind of big side effects. It is safe to be used, and it will be encouraged to use. And next we have eligible couple. Eligible couple or those couples who are married and the woman one who is present as in this couple is in the reproductive age, that is in childbearing age. They are known as eligible couple. Next, target couple. What is target couple? First of all, for which couple we can advise about the family planning method. You can't just advise a school going girl about the family planning method. You have to see which kind of couple to be advised. Like the couple one who has 2 or 3 children already, and for that couples you can advise about the family planning method to limit the number of children. But you know what, nowadays if the couple has one child, or even newly married couple is also being advised about the family planning service. Next we have cafeteria choice or cafeteria approach, and this is the rights of choice. Like the family planning program will be followed, but we have to give choice to that couple, to that individual, to which method to be followed. You can't say we have only this method, you have to follow this method only for the family planning purpose. No, you have to provide all the choices, like biological method, hormonal method, mechanical method. Even it's not temporary, permanent methods what are available, we have to provide the choices for them. In which method they are comfortable, they have to choose their own method. You can't implement your own. That is cafeteria choice. Let's see about the methods of family planning. In that, first we will deal with the temporary method. In temporary method, the first one is natural method. In natural method, we have abstinence. That is nothing but not having sex. Any kind of sex is restricted. They should stop it. Like not having vaginal sex, anal sex, or oral sex. If they are not having sex, then automatically the pregnancy will be prevented. And then second is withdrawal method. This is the couple can have intercourse without any kind of protection, but at the time of ejection of the sperm, the couple should withdraw the penis from the vagina. The main thing is to prevent the semen entering the woman's body. If it's not entering, then automatically pregnant can be withdrawn. And then we have a lactation amenorrhea method. This method is followed after the birth. That is, after giving birth, for next 6 to 9 months, the woman's body will produce more prolactin. That is, she will be breastfeeding. At that time, prolactin will be produced. When there is lot of prolactin, the ovulation will be suppressed. When there is no ovulation, when there is no egg release, at that period, the couple can have sexual contact, and the pregnancy condition will not occur. Only in 1 or 2% the pregnancy condition has been occurred. Second method, the biological method. And in this biological method, we have 3 types: calendar method, temperature method, and a mucus cervix change method. In biological method, the first method is calendar method. In calendar method, it is a calculation method. For 6 months, you need to see at what date you are getting your menstruation. Like in this month you got on 28th your menstruation, in next month in what date you are getting, like on 26 or 25. You need to keep on marking for 6 months. When you keep on marking for 6 months, after 6 months you'll get to know how to calculate. On calculating you can find which is ovulation date and when you can have sex and you can't get pregnant. Like on calculation you need to take the shortest interval and the longest interval. From the shortest interval you need to minus 18, from the longest interval you need to minus 11, and the period between this both shortest and longest period is known as ovulation. Let me explain you in detail. Like in last month the woman got menstruation and after 28 days she got her next month menstruation. So that is the shortest interval. It's not same for all. For her, she has been calculated, and if she see, she has got one time on 29th day, one time on 30 day, one time on 32nd day she got. On that if she see, the 28th day is the shortest interval. She took that 28th day, and the longest interval is 30 days. In shortest interval she minused 18, she got 10 days. In longest interval she minused 11, she got 19 days. And 10 to 19 days is the ovulation period. On that period she can't have sex. She can have before this, after this. That is, the first safe period is 1 to 9 days. The second safe period is 20 to 30 days. This is calendar method. Next we have temperature method. Temperature method is soon after waking up, you need to check your temperature. You should not get out of your bed. That condition itself, you need to check your temperature, body temperature. At the time of ovulation or when the ovulation is nearing, automatically your body temperature will increase in the early in the morning. By that you can find on which day you should not have sex. Next, mucus cervix change method. This method, generally there will be a white discharge or a jelly like discharge which indicates the ovulation period. If the discharge is very light watery, then in next few days, in 2 or 3 days, ovulation will occur. If the discharge is thick like thread like or like a cloth like structure, then the ovulation is going on. You should not have sex. These are the biological method. Third method, chemical methods. And before starting, in chemical method we have injection, tablets, gel, cream, films and all. Whereas if you see in hormonal method also, we will have tablets, injections based on estrogen and progesterone methods. Then why still the chemical method and hormonal method is kept different? It's because in chemical method you will not intake the tablet, you will not take the tablet in the mouth. Whereas hormonal tablet, you will take the tablets in the oral way. And chemical methods is only applicable when you will have the sex. Before having sex, the chemical method should be followed. Whereas hormonal method, it should be taken daily. Whether you are having sex or not, no problem. But to regulate the hormones, you should have it daily. Not daily, at least weekly purpose. There are different types of methods. One is daily and other is weekly. Whether having sex or not, but this method, in hormonal method, it should be taken compulsory. Whereas in chemical method, it's not compulsory. In chemical method, the first method is foam method. Here we will introduce the chemical into the vaginal wall of the female in the form of injection. For this we do have an example, that is delphin, and then vaginal tablets. Here the tablet will be inserted into the vaginal walls, and then this tablet will make the environment acidic in nature, so that the sperm which enters the environment will die and the pregnancy will not occur. We do have double check and orthophonic or the brands of vaginal tablets, and then we have gels and jelly creams. This is applied on the superficial layer around the vagina, it will be applied. And we have example for jelly, gel and cream. Next we have films. These films are like paper like structure. It should be applied on the tip of the penis, and after applying, the couple can have intercourse and they will not get pregnant. The advantage of this method is you can purchase it from pharmacy and there is no need of doctor's prescription is needed at this condition. whereas disadvantage is it has side effects, allergies, and it will not protect you from HIV and sexually transmitted disease. And next we have the fourth method, that is the mechanical method. And in this mechanical method we have condoms, female condoms, diaphragm, femcap, and IUDs. First, condom. Condoms are like a sheet like structure which is made up of latex, and it covers around the men's penis. And the main function of this condom is to collect the semen and prevent the sperm to get inside the vaginal area. And the other names of these condoms are rubbers, sheets, skins. And this is available in different size, shape, color, flavor, and all. While female condoms, this is made up of thin polyurethane sheets, and it has two rings on the each end. It will be like a sag or pouch like structure, and its main function is also the same, to not let the sperm to let inside the vaginal wall. And even after using this female condoms, there are few chances that women might get pregnant. Now, what are the advantages of the condom? It is safe to use, there is no any hormonal side effects, and it prevents us from the sexually transmitted disease, and it is available in all the pharmacies, and there is no need of doctor's prescription. And next, if you see, it is even available in the family planning clinics and other health centers also, and it will not cause chronic pains. That conditions will be reduced if the couples use condoms. And there is no need of doctor's advice for using the condoms. It will not affect the breastfeeding conditions, and all age men groups can use these condoms. And next, what are the disadvantages? In disadvantages, the enjoy of the sex will be very less, and couples feel embarrassing to purchase it in the public places, while few men are very allergic to latex, then that might cause itching in the area. And it takes a time to wear and remove the condom, and in some cases even partner feel embarrassing to ask to use the condoms. These are the disadvantages. Next, diaphragm, and it is a spermicide which is actually covered with silicone or latex layer, and this is actually inserted into the vagina same like the female condom, and it blocks the entry of sperm. While it can be used before having sex, before 6 hours it can be used, and for next 24 hours it can be kept, and there is no side effects for that. And even after using, there is a 16% chance that women might get pregnant. While next is femcap. Femcap is like a hat like structure which is made up of silicone rubbers like this it will be, and it is covered with spermicide, and it will be placed inside the vagina that blocks the cervix, which blocks the entry of the sperm. And next we have IUDs, and IUDs is nothing but intrauterine device which is like a T-shaped plastic device, and first it was discovered by Grumfenbrink. He discovered it with the help of silkworm guts, and then later it was converted to silver ring, and now we are using it in the copper wires. This IUDs has two types, non-medicated, medicated. The non-medicated IUDs are first generation IUDs which is just made up of plastics, and they are available in different shapes and size like Lippis loop, springs, coins, and rings. Medicated. In non-medicated we found the first generation IUDs. In medicated we have second and third generation IUDs. In medicated, with the copper wire we have hormones like progesterone present in it. In non-medicated there is no any hormone present in it. In this generation of IUDs we have copper T380A, copper T200B, multi-load, that is ml, multi-load copper 250 and 375, Nova T. These are the IUDs. Let me explain what is this. Like copper T, that is T-shaped frame which is made up of polyethyl. T-shaped frame which is made up of polyethyl, and the copper which is present, which is covering this layer, is 380 mm square. That is copper T380A. What is copper T200B? That is the T frame polyethyl which is covered with the copper of 200 mm square. Like that only 250 and 375. These are the IUDs, and let's see what are the advantage of it. Advantage is it will not affect any breastfeeding mothers. Even though the copper T is covered with progesterone, it will not affect the breastfeeding mothers, and it will not disturb during the intercourse. There is no any side effects of hormones, and a woman above the age of 20 can use. There is no age restriction above that, and there is no problem for in the time of reproductive years. It is safe to use at that time also, and at the time of fertility, that is when the couple has decided we need to have a baby, at that time that will be removed. Since it is a temporary method, it can be removed and normal fertilization will be occurred. And next we have disadvantages, like it will not protect us from a sexually transmitted disease, and there might be an infection occurring because of this. They have some kind of side effects, but not really a severe kind of side effects, and these are the sexually transmitted diseases examples. These are the disadvantages of IUDs. Contraindications of IUDs: if they have any kind of sexually transmitted diseases or infections like AIDS, gonorrhea, chlamydia, and PIDs, and any kind of infections or diseases like Wilson disease and leukemia, then they are not advised to use it. If the woman is allergic to copper or she is pregnant, she is not allowed to use it. And if she has a history of past history, that ectopic pregnancy, that is the pregnancy, the fertilization has been occurred in the fallopian tube or any other region apart from uterus, at that condition, the abnormal pregnancy, that condition, she is not allowed to use it. And if there is any kind of abnormal vaginal bleeding also, she is not allowed to use it. These are the contraindication. Next is side effects. Side effects of this is, while after using this, the woman has been experienced that the bleeding of during the menstruation is very long. There is prolonged bleeding, menorrhea is found, and the pain during the menstruation is severe. And the pain during the insertion, that is when this device is inserted, at that time generally the pain lasts for few seconds or minutes. This is normal, but in few women the pain has been lasted for hours and days. This is the side effects. The last method in the temporary method is hormonal method, and it has COC, POP. These both are tablets, contraceptive tablets, and then we have a weekly once pill, and then morning after pills, and then in injection we have a monthly once injection, and then progesterone only injection. These are under the hormonal method. Hormonal method. In hormonal method, the first one is COC, combined oral contraceptive pills. These pills are made up of in the combination of estrogen and progesterone. In together, one pill is made. How it works? First, primarily it will inhibit the ovulation. It will stop the production of egg and the release of egg. And secondly, it will stop the entry of sperm inside the uterus. It will block the way. How it will block the way? It will thicken the cervix in the way of transporting vagina, cervix and uterus. This is how the sperm transport. If the cervix walls are getting thickened and the way will be blocked, that way the sperm can't reach the uterus. And apart from this, this tablet makes the uterus environment as a acidic in nature, so that even by chance if the sperm gets in, because of that acidic nature, the sperms will get died. And then there are two types of COC pills. One is Malayan and other is Maladi. These are popularly used COC pills. These are available in the community camps and family welfare centers and other centers. Apart from these two, we have now several other products which have been followed in the COC types. What are the side effects of these pills? First, it will increase the heart, blood pressure, nausea, vomiting, dizziness, and in some patients, not very rare patients, depression is seen, and irregular bleeding is also seen. If you find any kind of side effects, you need to visit the doctor. And apart from this, mainly if you see any kind of this warning signs, you need to visit the doctor immediately. First is abdominal pain, chest pain, headache, eye problem and severe leg pain. If you see these symptoms, immediately do visit the clinic nearby you. And next, what are the contraindication for which patients you should not provide COC? Breast cancer, liver cirrhosis, any kind of tumor in the liver, and if the patient has any kind of heart disorder. POP, which is also known as progesterone only pills. By the name itself, you'll get to know this tablet consists of only progesterone hormone and there is no estrogen hormone. And this pills is also known as mini pills. And how it works same like the COC has been worked. Like first it will stop the ovulation, and second it will stop the transport of sperm inside the uterus by blocking the way and making the area acidic in nature. And this tablet is contraindicated for breastfeeding mother, and as well as COC is also contraindicated for breastfeeding mothers because COC and POP, this both tablet consist of progesterone hormones, and COC consists of progesterone and estrogen hormone. This both hormone, progesterone and estrogen hormone, if it is present in a woman's body, then these two hormones will actually suppresses the work or suppresses the production of prolactin hormone. For breastfeeding mother, prolactin is very important. Prolactin is the hormone which produces the milk. So if there is no prolactin, then there is no milk. So for breastfeeding mother, we will stop the tablets which has a content of estrogen and progesterone hormone in it. And next, once a week pill, this pill will be taken once in a week, like every Monday or every Tuesday, like that. And this tablet is also known as Saheli in general pharmacy or any kind of community stores. This tablet is available per 1.5 rupees per tablet. Morning after pill, that is if a couple has committed an sexual activity, that is unprotected sexual activity, the next morning or within 24 hours or within 3 days, mainly not after 3 days, within 3 days the women should take a tablet which consists of only progesterone in it. There is an example for this morning after tablet, that is after having an unprotected sex, the next morning or within 24 or generally within 3 days the women should take a tablet. So this tablet will stop the conception. The example for this tablet is levonorgestrel. And next we have once in month injection. This injection should be taken every month. If you skip any month, on that month it will not work. Like on that month, if you commit any unprotected sex activity, then there is a chance the woman might get pregnant. This injection consists of progesterone and estrogen in it. This can be taken the woman one who is in the menstruation period, and after abortion, that is after 7 days after the abortion, the woman can take it. And the woman one who is breastfeeding, after 3 weeks of breastfeeding she can actually take it. But in breastfeeding women, there is no need of taking this kind of injections, because breastfeeding, at the time of breastfeeding, the ovulation process will be stopped. The inhibition of ovulation will be done. There is no release of egg. So at that time, like for 6 to 9 months, the ovulation will be stopped. So at that period, if you have unprotected sex also, it's okay, the woman will not get pregnant. Next, progesterone only injection. This injection consists of only progesterone hormone in it, and one injection will work for 2 to 3 months. We have been completed temporary methods in family planning. Now we will focus on the permanent method in family planning. In this permanent method, we have two types. One is a female sterilization and other is male sterilization. These are the two types. And first, let's see the female sterilization. In female sterilization, we will see what are the methods that are present for a female to undergo permanent family planning methods. And in the female sterilization, we have two types, that is laparoscopy and mini lap. First, laparoscopy. In this performing, first they will inflame, in the sense they will insert the gas into the reproductive system, that is carbon dioxide and nitrous oxide will be inserted. And after inserting, a camera will be insertion will be applied. A camera will be inserted inside the reproductive system to see the fallopian tubes condition, how it is present and where the operation should be performed. They will see whether the way is clear or not, or any kind of scar is present or not. After seeing, observing, after visualizing the thing, they will perform the operation. Insertion will be applied, and then there will be a clip will be kept in the fallopian tube. Now they are performing clip method. In previously they used to disconnect this fallopian tube and then they will knot the part. If they disconnect and they put the knot, when the sperm comes this way, it can't cross this way. Even now when the clip is performed, it will block the way the sperm comes and it can't cross this way. That is how the laparoscopy is performed. And this laparoscopy has some kind of following that after the delivery for 6 weeks the woman is not allowed to undergo laparoscopy. Apart from this, the woman one who has a heart problem, respiratory system problems, diabetes or hypertension, and the blood level less than 8 mg by dl, at these conditions the woman is not allowed to undergo this laparoscopy. Next we have mini lap. This is called as mini lap because here the incision is very small, that is around 2.5 to 3 centimeter. Here first the doctor gives the anesthesia or the sedative to the patient. After this small incision will be performed, and by the help of that incision the blocking of this fallopian tube or the cut of the fallopian tube will be performed. This block will prevent the entry of the sperm. And in this mini lap, it can be performed immediately after the birth. There is no need of waiting like 6 weeks and all. Like laparoscopy, you need not to wait for long time. Immediately after the birth, the women can undergo mini lap, or immediately after the abortion condition also the women can undergo. The only problem is, even performing of this mini lap, there is a chance that women might get pregnant. That is, in previous days only 1% in 200 women used to get pregnant, while now 1% per 55 women are getting pregnant. What are the advantage and disadvantage of female sterilization method? This method is very effective, and it will not affect the female ability of having sex, and there is no any side effects. While when it comes to disadvantage, once the operation is performed, it can't be reversed, and the operation pain is seen for many days, and because of the operation there is injury in the internal organs, and there will be lots of bleeding and infection also can be seen. Male sterilization method. In male sterilization method we have vasodeferens. In vasodeferens we will prevent the transport of sperm. How it is performed? First there will be an opening performed in the scrotum. After opening the scrotum, there in each testis a vasodeferens is present. This vasodeferens works as a transport of sperm. So the connection between this vasodeferens will be cut. Like there will be a cut in the vasodeferens, and to each end a knot will be applied. This is how the vasectomy is performed. When there is a cut, then automatically the transport of sperm is stopped, inhibited. And soon after performing, it doesn't work. This method takes months together, almost like 3 months. In the number wise, if you see, almost a person can eject 20 times sperms even after performing this method. After 3 months, this method start to be in an effective manner, and until 15 days the person is asked to wear the T bandage, and he is not asked to lift any weight, no heavy exercise, and nothing should be performed, in which way the pressure is applied on his body. And then after 5 to 7 days the stitchings which is applied will be removed. Let's see what are the advantages and disadvantages of male sterilization method. It's same as the female sterilization method, like it's permanent, it will not affect the ability of having sex, it's very effective, and there is no side effect. When you see in disadvantages, once the operation is performed it can't be reversed, and because of the operation there will be a injury and bleeding can be seen, infection also can be seen, and the pain and uncomfortable because of this operation is seen for 2 to 3 days. While when the operation is performed, it's not suddenly effective, it takes some days to be effective. These are the advantages and disadvantages of male sterilization method. Role of nurse. This role of nurse is not only applicable for family planning programs, it can be applied to any program that is introduced into the committees, like MMR, RCH, Safe Motherhood, in general family welfare program also. So it's like a general nurse's role. Okay, first one, counselor role. See, when a couple come to a committee or come to any program, they will be confused whether what to do, what not to do, whether we should participate in it or not, whether this has any effective method or it is just give us any side effects, or they'll be very frightened, they doesn't have any confidence to come in it. So as a counselor, our work is to solve their questions, solve their doubt, give them courage, encourage them to participate in it. And next, administrative level. See, when act is involved, like when program is introduced into the committee, it will be not just introduced in one level, like it will be introduced in national level, state level, district level, village level. In village level itself, they will be divided into different routes, like this division, east division, west division, like that they will be divided. In each division there will be lots of departments. So either the way you will be performing as a head of any team, so your administrative level should be in a positive way. Next, supervising role. Yeah, this is very important. Supervising role is not just like you have to go and observe them and instruct them, you have to do like this, you have to do like this. It's not like that. Your main work as a supervisor is, if anybody is performing anything wrongly or anything in a unethical way, you need to correct them. You need to teach them how it has to be performed. Not just shouting at them, your vital role is to teach them. And next we have functional role. Functional role is like you are involving in it, like you are having a good IRP with the committee members, good IRP with the person want to come to attend the program. You have to get involved with them and you have to guide them, like this method is best, you can go with this method is best, you can go with it, or you have to work like this. This is what functional role. And next we have educational role. This role is found in everywhere. The main concept of introducing an act or program is to provide education, create awareness about the particular concept. For example, if you are talking about family planning, the main concept is to provide information about family planning, what is family planning, where and all the family planning is available, like which clinic, what is the emergency number to contact those things, is there any side effects or not, how to control the population, how to get rid of the sexually transmitted disease. These are the educational role. Well, when it comes to MMR, how to protect the mother from the death rate, how to protect the mother from the disease rate, how to give a mother care during the antenatal care. This all comes under educational role. Well, next, the role of research. Yeah, when it comes as a role of research, research is not just like finding the medicine or finding the vaccine. This is not just research. Research is like discovering a thing, that is a research. See, when you are performing a committee, when a program is conducted, at that time, for example, you take family planning itself. In family planning, you will be conducting, you will be talking to many couples. When you talk, you will be recording everything, you need to note down everything. At that time, while noting down, you'll get to know how many couples are interested in it and why are they interested in it. Like, for example, the couple from the age to 28 to 35 are actually involved in the family planning. So that census will actually give us a clear notification for which age groups we should concentrate. This is what actually research is. Like we are getting the complete detail about it. And this is also useful for the study purpose also. These are the nurse's role. Infertility. Infertility means when a couple is practicing a unprotective sex way or unprotective intercourse, but still after practicing for almost 1 year or above 1 year, the woman is not getting pregnant, then it's an infertility condition. It is of two types, primary and secondary. Primary is the woman has never got pregnant. In her lifetime, she is not even a single time she got pregnant and she is not able to get pregnant. That is primary infertility. Secondary is she got already pregnant, there is one living child and one or two living child, and after that, now when they are practicing, she is not able to get pregnant. That is secondary infertility. While according to the census, almost 8 to 12% in this world, the women are suffering from infertilities, and the causes are, one is non-preventable, another is preventable. Non-preventable in the sense, if a woman gets infertility condition because of this non-preventable causes, then we can't cure it. Like if it is due to any genetic problem or heredity problem or anatomical problem or any hormonal imbalance can actually be managed, but we can't assure that 100% it will be cured. Preventable cause, we have infection in various way, like one is sexually transmitted infections or normal infections due to hormonal imbalance or due to any deficiency. This type of health conditions can actually delay the pregnancy condition. Apart from this, if a woman has any previous history of abortion, that is due to infection, or in the postpartum period if she had any infections or any abortional conditions and complications, mainly because of these previous things, now the pregnancy condition can get postponed or can get delayed. And if she is exposed to any kind of toxic substances, one is environment, other is diet. If you see in environment, arsenic is main. Like if a woman is belonging to a poor family, she might go to a routine work like breaking the bricks in that environment. When she is breaking the bricks, from that dust arsenic is released, which is very dangerous. And if she is working any kind of agriculture way, pesticides will be used, and she is inhaling the pesticides spray or hair drops, then that will affect her pregnancy condition, that will affect her reproductive system. And if in lifestyle, if you see, that is diet, if the woman is involved in alcoholic and tobacco system, that also delays the pregnancy conditions. And if a child is forced to get married, or early age marriage, and forced to get involved in sexual activities, and multiple sex partners, and if she has any problem in her genital system, this all also can actually postpone the pregnancy condition. And if there is any pelvic inflammatory disease, like any injury or inflammation or damage, or any kind of illness in the organs that is related to the pelvic or reproductive system, then that can actually delay the conception. Lab investigation, in that for male we have different, for female we have different, absolutely. For male we will perform semen analysis. In semen analysis we have two conditions, that is azoospermia and oligospermia. Azoospermia means absence of sperm. Even after performing the ejection manner, there will be no ejection of sperm. While oligospermia is after performing the ejection manner, only a few amount of sperm will be released, that is low count of sperm. And next, in a female manner, we will see the basal body temperature, cervix mucus release. Based on that cervix mucus discharge, that is in jelly or white color discharge, whether it is in the thread form or whether it is very in light fluid form, watery form, based on that we will get to know how the process is getting inside, whether ovulation is happening in the correct date or not, whether ovulation is delayed, is there any problem inside or not, we'll get to know. And by endometrium biopsy and ultrasound, we'll get to know how the structure it is inside, is there any tumor present inside, or any kind of obstruction is present inside, we'll get to know. And hormonal assay, because of this we will get to know hormonal production is correct or not, is there any hormonal imbalance or not, PCOD is present or not, or any kind of hormone disorder is present or not, we'll get to know. These are the lab investigation. Treatment in the medicational way, for the high estrogen level patient. For high estrogen level patient, we will provide a medication known as Clomid, that is also known as clomidphene, that is of 50 mg, and it will be given regularly for 5 days. At the time of night, the women should take one tablet for continuously 5 days. In 5th day afterwards, the ovulation occurs. How it works? Clomidphene actually acts on the hypothalamus, that will regulate the release of the FSH hormone, which leads to ovulation. In low estrogen level patients, we will give Pregonal or Pregial, which actually consists of FSH hormone and LH hormones, which actually leads to ovulation. Surgical techniques for infertilities. If we find any kind of injury or scar or any kind of abnormalities in the organs, we will try to correct it by using the medications. If that's not working, we'll go with a method known as artificial insemination and in vitro fertilization. And in artificial insemination, we will collect the semen from the husband, or if the husband is not capable for that, we will go with the donor's semen, and that will be inserted into the mother's uterus. In vitro fertilization, we will collect the mother's egg and father's or the donor's semen, and that will be fertilized in the lab and then get implanted into the uterus. Artificial insemination. This is a process where a semen is collected and that will be inserted into the uterus of the woman in an artificial way. So, the semen which is inserted will be very fresh. It's not a prolonged semen, because if it is prolonged, there might be a contamination problem, infection can occur, even the sperm might be dead. It will not be active and healthy. So, we will use the fresh one. And how the act is performed, there is a tool which is known as posterior fornix, and that will be placed in front of uterus to open the cervix. In the vagina it will be placed the posterior fornix, and that will open, that will widen and open the cervix. when it is opened with the help of injection that is connected to tube will be inserted inside, that will reach the uterus. When it has reached the uterus, the semen will be inserted, and this act will be performed generally before the ovulation process. For many women, at the time of ovulation, daily this process can be performed. For few women, one or the other day, like if today it is inserted, tomorrow no, and after the other day, yes, like that. In this, the semen can be collected from the husband or the donor. The husband, in the conditions like if he has any spinal injuries or any kind of injuries that he can't perform any sexual activities, then the sperm is collected from him. In the donor case, if you see, while collecting, we will make sure the donor doesn't have any kind of genetic problem or any kind of hormonal disorder, so that the baby which is born should be healthy. How IVF is performed: first, the doctor provides the stimulation hormonal tablets or injection to the women, because the egg which is produced should be very healthy. On a particular day, from a woman the egg will be collected, and from the husband or the donor the semen will be collected. After collecting, on the same day the fertilization will be performed under the microscopic in an hygiene manner, and for next 5 days the embryo culture will be performed, that is the division of cells. And if you read how the baby is formed, how the fertilization takes place, around 5 days the embryo which is getting formed will get in a ball like structure, that is what here, and this will be transplanted into the women's uterus, and after getting transplanted, that is ET, after performing this, in next 14th day the woman gets pregnant. This is IVF. Congratulations guys, this is the end of the OBG syllabus, and now we have been reached the end. These are the possible questions from this chapter. Do practice well, score well. All the best for your exam. Meet you in the next video. Until then, stay tuned. Bye.